Hi, let me introduce you to Bella. Bella came in on Friday, and if you have a look very carefully, she came in, her owner came in because she's got this lump below her left eye. Well, when a veterinarian, there's many possible causes for lumps like this, but for us veterinarians, the first thing we immediately think of is a tooth root abscess. So this tooth here has 3 roots and one of them comes up right below the eye. And I can't show you in her mouth, but there's actually some pus just leaking out of that little hole there. And that hole is associated with this tooth. So a lot of owners will come in and say, oh, my dog's been kicked in the eye or being bitten by a bee or something like this. But when we see this, the first thing we think of is a tooth root abscess. And the fact that she's got a little draining hole in here and a tiny little nick on the crack in the enamel of the tooth just confirms that. So what's the treatment? Well, you can do a root canal, but you have to go to Sydney to have that done, and it's very expensive. So the other choice that we can do is a course of antibiotics. 95 cases out of 100 where we give a course of antibiotics, the problem will settle down, and then a week or a month or 3 months after the antibiotics stop, it'll come back again. And the reason is the bugs at the tip of the tooth, you just can't get them all out of there with antibiotics. So when the antibiotics stop, the thing just bounces back out at you. So the best and the most realistic option is that we operate and remove that tooth. Now, that tooth has 3 roots, and if we just try and pull it straight out, it doesn't happen, it doesn't work. You can't pull it out that way without breaking the roots and then going in to have to look for them, which is very difficult. So what we do is we actually saw the tooth in 3 pieces and then take each root out separately. So we'll go into the surgery in a minute, we'll put her under anaesthetic, and then I'll invite you back in and you can watch as we do this. Obviously she's got a terrible headache, she's on painkillers for that, but as soon as that tooth's out, that'll all settle down and she'll be back to normal. So the noise you hear in the background is not a dog in pain, so don't be alarmed or distressed about that. That's one of our patients recovering from an anaesthetic, and some of them will vocalise a little bit like that on recovery. So that's all cool. Okay, so I've elevated the gum off to quite some degree, all the way around from the front of this tooth to the back. And then there's a little, what's called a furcation, F-U-R-C-A-T-I-O-N. And so that is one of the natural splits between the roots. So that is the furcation there. So you can see that's gone right round, right through, and that goes to the other side. So that's my first landmark for sectioning this tooth. So this is my high-speed burr or high-speed drill, and we'll just use this to cut through the tooth. Obviously she can't feel a thing, she's under anaesthetic, and also I've done a nerve block on this tooth. Generally, with most dogs having extractions of teeth this big, we will do a nerve block because it gives us better pain relief, the same as you or I would have if we're going to the dentist, except the dentist wouldn't anaesthetise you. So that's this first root sectioned, and now I'm going to get stuck into taking that root out. I'll see you again shortly. So we stopped a second ago where I cut that first root loose, and now we're about to get it out. Now, once upon a time, we'd have elevated the gum and used this high-speed burr to burr away the whole side of the socket holding the tooth in place. But we no longer do that because we have this magic piece of equipment called a periotome. So this periotome will actually, so every tooth fits very tightly into a socket, and there's a tiny space between the tooth and the socket. It's about 1 mil, and so this periotome will go up around the outside of the tooth, but inside the socket, and break the ligament, destroy the ligament that holds that tooth in place, and then I can just pull the tooth out. So it saves a massive amount of pain for the patient, and it saves a massive amount of recovery. Obviously, burr bone away, it's going to hurt for quite a little while. So this periotome, we'll just start it, and you can, if you have a really careful look, you can see it just millimetre by millimetre driving up into that periodontal space. It's very, very slow. You've got to be patient. Not a virtue that I had a lot of years ago, but I've changed my ways. I'm now very patient, especially when I've got a great tool like this that'll make her life so much easier. This doesn't really save any time. It may save a little bit of time with some teeth, especially those big carnassial teeth. But the big advantage of this tool is the what we call the morbidity. Morbidity means pain and suffering. So there's a lot less morbidity with this tool than there is to use the old technique. I've been working away with this periotome for about 3 or 4 minutes now, and I think this root is really loose. So I'll put this periotome back up, and we'll do a little bit of levering, and we'll see if that root tooth comes out. There you go. Comes out. Let me just grab a pair of forceps. So there you go. So there's the one root, this root, which is totally intact. I've now got to get the other 2 roots out. But you can see how much simpler it is for her with that periotome. So you can see what we're left with here. These 2 roots go up like that, and now we start to work on those. So I'll show you as we start getting them a bit closer to removal. I've been at this only about 30 seconds, and I'm noticing this tooth is already starting to get loose. Just twisting that periotome very slightly, and see how that tooth is just really, really nicely getting loose. So that's how easy this machine makes it. Just want to show you this tooth. There are the 2 sections, and I'll put them on the ground. And there is one root, there is the other root, and that's the missing root. If you have, and I don't think the phone will focus in well enough, but you can see how spiky those roots are. This root should be the same. And you remember I said at the beginning I had to cut it into 3 pieces. Well, the infection has eaten away this whole root, and that's why she has all that swelling. So that root's just been destroyed, and that's why I didn't have to split this piece lengthways to get 3 pieces. So if we put this all together, this is what this tooth looks like or looked like. So you can see it's a 3-rooted tooth with all the teeth, with all the roots going in different directions. And because this one at the front here has been eaten away, that's why I could get this out a lot more easily. So cool. Now, one other thing I just want to show you. Now, as I said to you right at the beginning, she's coming in because she's got a tooth root abscess on this left-hand side. When we anaesthetised her, we put this ET tube, or this endotracheal tube, down her throat. I had a good look at her mouth the other day when I did the physical examination when she came in, but I couldn't see this. And let's have a look inside her mouth. So we'll turn this light off. And if you have a look in here, I don't know whether you can see it or not, but this is the a lower molar, and it's got a huge crack and a huge split just on the inside. Now, I couldn't see that from the outside because on the outside that looks perfectly okay, but we're now also taking this tooth out. We've just obtained permission from her owner. And if you have a look at this black hole there, that's the nerve exposed. So she's been in massive pain with that nerve exposed, but from the outside everything looks hunky-dory. So this is how good dogs are at pretending to be okay. Massive split, massive crack in the tooth, lots of pain, but not showing any signs of it because she knows she needs to pretend to be healthy. That's sort of the way of the wild. So, and I also couldn't see this on the outside, and people ask me all the time, why do you need to anaesthetise dogs to have good looks in their mouths and check their teeth and remove teeth, etc., etc.? You know, we sit in the chair. Well, that's a great reason. You've now seen it for yourself. So I'm going to get stuck into this other tooth, and I'll see you later. I've got to leave the light on so I can see what I'm doing. I'm actually putting some sutures into this gum. I've already taken the tooth out on the other side, the fractured molar that I just showed you, and I've stitched that up already. So now I've just come back to this first tooth and put some sutures in that. Because the periotome makes a huge decrease in the size of the hole that we make, in a lot of cases we don't suture these up at all, and in a lot of cases it's impossible because we haven't had to make a gum flap or anything else. But there is an opportunity in her to just put a couple of sutures in and just help decrease the healing time a bit. Now these sutures are dissolving. You may think I'm not being very neat, and that is actually the case. This isn't designed to look pretty, it's designed to be functional. It's going to be inside the mouth, and the saliva will dissolve these sutures in a very short period of time. So we're just putting them in just to give the gums a little bit of support, and decrease our healing time required just a little bit. So that's this girl Bella done, and she'll be going home this afternoon and be pain-free for the first time in a long while. And over the next few weeks, this swelling under the eye will settle down, and she's got a course of antibiotics at home and a course of pain relievers already. Gave that to her when she came in the other day. So that's it. I'll see you in the next video.